What seems to be very clear now is that, having borderline personality disorder is not the person's own fault. I repeat again, having borderline personality disorder is not the person's own fault. It is nobody's fault. There is a national guideline which is about 10 years old now. According to the national guideline for borderline personality disorder treatment, borderline personality disorder is a disorder of the brain and the mind, not the person's own fault. See, all of us are born with brains which function slightly differently. Some of us can be born with brains which are sensitive to emotions, and that in itself is not abnormal. A lot of us are sensitive to emotions, and it can be a gift. Now, if we are sensitive to emotions, plus if we have had certain challenging circumstances, usually while growing up, together that can lead to a way of thinking, feeling, and behaving, which we call it as borderline personality disorder. It's a combination of factors, both biological factors, psychological factors, and the social factors. All of them together contribute to a person developing borderline personality disorder. Now, often it is said that trauma causes borderline personality disorder. That link has not been clearly established yet. Now, what we know is that trauma is very common in borderline personality disorder. More than 80 to 90% of people with borderline personality disorder report histories of trauma. Whether one causes the other, that's not been worked out. Because we know that even people, when they don't have any trauma, they still can develop borderline personality disorder.